Next question, we have one asking about age spots. So let's break that down. What can we do? What are they? Why do they happen? And most importantly, how do we get rid of them?
If we're talking about an age spot, which in our realm we would call a lentigo. A lentigo has in our brains sort of a histological look to it and a pigment that is located in the epidermis. That is a perfect scenario for a laser treatment or a light treatment. It's commonly known as phototherapy or IPL or BBL or photofacial, it used to be called as well, way back in the day. And that's kind of a go-to treatment for a lot of people for a good 20, 25, 30 years. And it does work really, really well to get rid of those age spots on the hands, on the face, on the neck, on the décolleté.
Chest, body. I mean, they're typically they are sunspots. So these lentigines, the other name for them, it's sunspots, and they really do happen from sun damage that happens over years, and they accumulate. And most people with fair skin will get at least a few. Some people get many, and IPL really is sort of like the safest, easiest introductory way to get rid of these things. And certainly we do get great results. We have some people coming in and they start, they love the results so much on their face and the neck. They come in, they do their chest, their shoulders, their arms, even like sometimes across the back. So depending on the device that you're using, some of them are very fast, so quite easy to cover a very large territory of skin safely.
And it's comfortable, but it feels like a kind of a zappy sensation. The more target you have, so the darker the brown, the more energy is exchanged in the process, and it can feel zappy. So as you go, it gets a little bit more tolerable as well. And these lentigines are spawned on and stimulated to revive by exposure to sunshine. So they can come back, and that's why you hear of maybe yourself or your friends that have had 2 a year maybe for a few years, or once a year for maintenance. And it's a go-to treatment for a lot of people.
Yeah, absolutely. I mean, I have to say, certainly that's been my habit for years. I mean, as much as you protect your skin with wearing a hat and sunscreen, there's always a little bit of sun that's going to get through, because we really can't block 100%. So I always sort of tell everybody, it's kind of like going on that January diet and losing the 2 pounds, because inevitably, as careful as you are with your skin, you're going to get a few coming on. So we kind of think that people that have the best success over a long period of time are people that just incorporate this into their skincare routine. So 1, 2, maybe 3 over the course of the year, just to keep everything really clear. We should distinguish, by the way. So
not all brown spots are the same.
All right, they're not all the same. Yeah, exactly. So, some people call them age spots, and really what they're referring to, rather than the lentigo, which is sun-induced, the seborrheic keratosis. So that's a different entity altogether.
Sometimes even we can't tell them apart. They're sneaky little flat to just barely raised, slight textured tan, maybe medium brown, sometimes a little darker brown. They can have a little kind of edge to them, and they just don't respond to IPL at all. And so if you've ever been stuck in a situation where you keep going back for that IPL and your spots don't get better, it's because it's a macular or a flat seborrheic keratosis. And they are sneaky and hard to treat that way. So we have other ways to treat them. The other ways to treat them are, it's a more of a destructive or an ablative type effect. So that's where maybe the dermatologist steps in, and we would treat with a hyfricator, which is a hot, ablative, electrical way to remove the surface of the skin. Cryotherapy, which is the opposite. It is an intense, fast freeze of the very surface of the skin. There's definitely reasons why we would choose at the bedside one or the other. And so that's where, in your hands of an expert, that's where we make those decisions. And then there's, of course, ablative lasers, where layer by layer, micron by micron, we are going to strip away those extra layers of the surface of the skin to get rid of the pigment and the brown and the spot itself.
Yeah, and unlike the lentigines, which you can, largely prevent with the use of good sunscreen, seborrheic keratoses, they simply just come with age.
So frustrating.
And there is a genetic predisposition. So I kind of tell everybody, look, everybody's going to get 1 or 2 over their lifetime. Some people will get dozens and dozens everywhere, whereas some people it's really only a few. So it is good to treat them. because they really only grow with time. So, and it is much easier and the results are better. We get better long-term clearance when we catch these things a little bit earlier than later.
Okay, let's discuss another spot, which is a cousin of the lentigine. It's called an epiphyllid or a freckle. And for me, the freckle is almost identical, but the melanin in a freckle is always going to be really on the yellow side or the really light side. So those are really hard to get sometimes in a very light-skinned individual where we're trying to get very even skin and back to sort of a more natural, all over homogeneous skin tone. So those are a little bit more difficult to treat. And again, we need different lasers, different wavelengths, different energies to try and get those epiphylids or freckles off the skin. Now, we often have a lot of people who don't want to get rid of all of their freckles. And that's a consideration and an important conversation to have with your laser provider, to not have, say, your face looking one color and then the freckles on the neck or the chest looking a different color. So we can kind of adapt and work around that.
Yeah, and I would say it's really very important to take all of those considerations into account. And there's tricks that we have with how we play with the laser settings or even what type of device we're using. So of course we have many different types of lasers. So depending on the device you're using, you're going to get really a different outcome. So we always try to have that conversation in advance. Do you love your freckles? You're just looking to de-intensify them, let's say like 50% less noticeable? Are you really trying to get rid of them? As you alluded to, the whole issue of blending it, so making sure that the face matches the neck and the neck matches the chest. So all those things are really important to consider in advance. And so another question, of course, with these brown spots and age spots is, do creams work to get rid of them? And again, long and short answer. So the short answer, not really. Long answer, yes, if you're using retinols, especially higher strength retinols or prescription retinols, you can get a lot of peeling with that. And as you peel or exfoliate the skin, you can see some lightening of these spots. There are some over-the-counter creams that are meant to kind of lighten them. I find they really don't work that well, really not. You'd have to be so persistent in the use to maybe see a 20 to 30% improvement over many months. So I would say for most people, it's not really worth the exercise and the time. The lasers and other procedures are just way more effective.
Thank you for your questions, and keep those questions coming. We love to hear them. We love to help you, educate you, and get all the facts straight, that's for sure.
Great. Thanks for watching, everybody. Keep your questions coming.